Hello, everyone, and good morning. It's kind of neat standing down here, a bit surreal because just a few years ago when I was in pharmacy school, I used to be in the back row. So I see Aaron sitting up there. It's a good place to be, and a few of the folks. So it's a real pleasure being here. I want to thank Mark and Nicole as well for putting this together. Pharmacists and in our profession, we're always busy doing, and so sometimes the word doesn't really get out about all the good things that are going on with technology, with innovation in our practice. And so this is a great forum to be involved in. You know, with our pharmacies, I'll give a bit of background about how we got into this HIV pilot. You know, we have our Pharmacy with Care program, which Renee talked about before. And with that, we're seeing a lot of results in terms of patient health. You know, we're bettering their health outcome. We're increasing their compliance. And so, you know, our team and my partners, our real vision is to be leading the way with technology and with innovation. And so we're continuously striving to find technologies that we think are applicable in pharmacy. So Health Tab also being one that we were involved in. This HIV project, I came across the test, which is called INSTI, manufactured by Biolytical out in Richmond. And the thought was, you know, why can't this point of care test be conducted in pharmacies? And so I went to the guru of HIV/AIDS, Dr. Julio Montaner, to discuss the idea. And he thought it was a good idea to pilot and to see, see what results we would get. And so I got in touch with the CDC, Vancouver Coastal Health Authority, and this pilot was formed. And so I'll get a bit more into that with the presentation, but initially I want to show you this video just to show you how really easy and how quick this test is to perform in the pharmacy. And you can see that was all done in less than a minute. So it's quick, it's rapid, it's the most accurate test that's available in the world as well. So the partnership, you can see here, Providence Healthcare, Vancouver Coastal Health. We had Island Health Authority involved as well. And the Ministry of Health was also involved in this. They actually do sit on our committee. What I'm going to go through is the evaluation of the pilot, which Vancouver Coastal Health did back in the fall. This presentation I'm going to show you today, I actually just presented it to the College of Pharmacists a couple of days ago as well. So these are the partners involved. Public-private partnership. Again, we've talked about that. The rationale here is, with the framework of Hope to Health, providing strategic direction to the health authorities towards an AIDS-free generation. The evidence shows that the majority of newly diagnosed patients with HIV, there's actually been missed opportunities in healthcare for earlier diagnosis. So this pilot was important in that aspect as well. As part of an overall approach, combining routine offer in healthcare settings and targeted testing for key populations, and in a non-traditional setting to see if that may increase access to the testing. The pilot took place over a 12-month period. Again, it was offered free of charge to the customer. I'll get into that in a little bit. There was funding that was provided. Vancouver Coastal Health provided training, support, We did data collection, reporting, quality assurance. So they came and actually trained all of our pharmacists and pharmacy staff. Our pharmacies are co-located next to medical clinics. And so they came and did some training for the doctors as well. They were a key part of this pilot, and having them on board and involved was very important. The fee that was paid to the pharmacists was $15, and that money came from the Island Health Authority. And the actual test kits were provided by the BC Centre of Disease Control. So we launched in July 2014 here in Vancouver, at a couple of sites on Fraser Street and Kingsway. In Nanaimo, they're just a month later, and initially Vancouver Coastal Health put out a media release which got huge, part of an overall approach, combining routine offer in healthcare settings and targeted testing for key populations, and in a non-traditional setting to see if that may increase access to the testing. The pilot took place over a 12-month period. Again, it was offered free of charge to the customer. I'll get into that in a little bit. There was funding that was provided. Vancouver Coastal Health provided training, support. We did data collection, reporting, quality assurance. So they came and actually trained all of our pharmacists and pharmacy staff. Our pharmacies are co-located next to medical clinics. And so they came and did some training for the doctors as well. They were a key part of this pilot, and having them on board and involved was very important. The fee that was paid to the pharmacists was $15, and that money came from the Island Health Authority. And the actual test kits were provided by the BC Centre of Disease Control. So we launched in July 2014 here in Vancouver, at a couple of sites on Fraser Street and Kingsway. In Nanaimo, they're just a month later, and initially Vancouver Coastal Health put out a media release which got huge provincial attention, and as well as across the nation. And so that really helped in getting the pilot off the ground in terms of getting people aware that it was now available. So as I mentioned, we received extensive training. The process involved, if we received any preliminary non-negative result, the patient would be referred immediately to the doctor next door. And they would then provide the additional counseling. They would be put in touch with the STOP team at Vancouver Coastal Health and make sure that they received the full support. So all the positive tests would be reported to public health. Monitoring and evaluation. So the pilot evaluation included testing volumes, yield, the population tested, including the demographics, pharmacist experiences, and client satisfaction. The questions that we looked at were basically, how feasible is this in community pharmacies? And to what extent was this point of care test acceptable to the clients that were coming in? As well as how do point of care clients compare to clients tested through other services? So percentage of first time testers, gender, ethnicity, and positive yield. Methodology, so there were interviews that were conducted with the pharmacists. There was a review of the administrative data collected and an online client feedback survey. So the main findings were, in Vancouver, we did a lot more tests than they did on the island. I think that might have had to do with population size. And you can see here that after the initial media, there was a huge spike, but relatively speaking, the testing volumes, there was a small decline, but we still managed to accomplish almost 1,000 tests throughout the pilot period. Demographics, so predominantly male, which was something Vancouver Coastal Health was happy with, because the males are less likely to go and get an HIV test done, whereas with females, of course, during pregnancy, it's involved even in that process. The ethnicity in Vancouver was a decent mix, whereas on the island, the populations of the pharmacies that were chosen there were mainly Caucasian. So POC testing was very feasible for pharmacists to implement. So on average, you can see here they gave it a rating of 8.2 on a scale of 1 to 10, where 1 would be considered very difficult and 10 very easy. The training was rated as good. One of the pharmacies had to create a private space to conduct the tests, whereas the other ones had existing ones. So privacy and confidentiality for the patient was obviously very, very important. Some of the challenges. So, the learning curve of adjusting to a new practice, making the clients feel comfortable. And, there's a few folks that would come in and, just would be uncomfortable with the sight of blood. So the pharmacist played a role in making them more comfortable. Lack of anonymity. We were just asked for their name and date of birth. So, and of course, the slowdown in the uptake. So the benefits here and the opportunity to provide expanded therapeutic service, the trust factor with the pharmacist was a huge deal. These are some of the comments that came in from the surveys. Adding an interesting component, amazing interactions, feeling that we're doing a noble job, caring beyond prescriptions. We increased the awareness of HIV, according to the survey as well, and the pharmacists themselves found it very rewarding to have been involved in the pilot. This is on the client satisfaction, so you can kind of scan through that. They found the information provided by the pharmacist was great. Convenience of the test was a big factor. Professionalism, the amount of time that the test took. The waiting time to see the pharmacist once the test was, or once they arrived to the pharmacy, and so on. For the clients, here's some of the results of their drivers for accessing pharmacy. They could get it done right away. Wasn't going to take too much time. It was free, and in this case funded. The trust factor with pharmacists and so on there. So here's the client feedback on them increasing their knowledge on HIV prevention. So 71% of the folks found that it was a great deal of increased knowledge for them in HIV prevention. Increasing understanding as well. 78% of them surveyed that increased significantly. So here's some of the costs that were involved in this pilot. So as I mentioned, $15 was paid to the pharmacist. The kits were provided by the Center of Disease Control, but that was their cost. $4,800 were spent in terms of marketing, and then that included one of the 4 stores at renovation costs. That was paid for by the pharmacies, of course. In-kind contributions from the health authorities, so training of the pharmacists, project management, communication support, data support, and testing kits. And so in total, it was a small number, $46,000 that were spent on this pilot period. So of course, with any pilot, there are some limitations on the findings, the generalizability of the client survey results. From the island, unfortunately, we didn't get any client feedback. The survey was conducted at the Vancouver locations. I'm not able to compare the POC clients to clients who are already getting HIV tests in other areas here, with Vancouver Coastal Health, with nursing clinics and other venues, other areas. And we didn't get any preliminary positive test result during that period. We did, however, just recently get a positive or non-negative result post-pilot period. So when the pilot ended with the health authority funding in the summer, Vancouver Coastal Health actually continued the funding for the pilot. And, this case was interesting in that the patient didn't provide their real name or real information. The day the test was done and this result was found, the doctor who was working in the clinic next door had not been trained in the original pilot period. There were a provisional doctor that were working there, and so the patient was told there was going to be a 45-minute wait. And so they said that they would come back and never did. And it was kind of a weird scenario. Our staff kind of felt like, they already may have known that they were positive, and it was a interesting, kind of a weird experience at the pharmacy level. But again, purpose of a pilot is, these things happen. Vancouver Coastal Health Authority shared at the college that people do run away, even in the settings that they perform the test, and that's just a part of this. And so we're working on improving that. Continuous training provided by the health authorities at the medical clinics and at the pharmacy. I'll just go through quickly on what we did learn. So we did 1,000 tests. A large proportion of the people that were tested were first-timers. That was actually the best result of the pilot was this stat, and I'll get to that, I think, in the next slide. The other thing was pharmacists were very comfortable in delivering this service. Vancouver Coastal Health tried to do this HIV pilot a few years earlier with another pharmacy, and they got some pushback because the pharmacists weren't very comfortable in doing this test. And so us getting on board, getting the pilot, and getting the results done, I think we've shown that our pharmacists were very comfortable. We've seen how the test is conducted. And so I think that will help in potential future pharmacists to get that sense of comfort that this can be done. The value offering still needs some further evaluation. Of course, the diagnostic yield was very low. There was staff turnover, and of course the linkage to care. And so currently, as I mentioned, we are still conducting these tests. Vancouver Coastal Health Authority is still funding it. Fraser Health Authority has expressed interest, and we're looking to partner with them as well. The idea for a possible next phase is obviously, the College of Pharmacists is on board. They wish to collaborate. Of course, getting BCPHA involved, I think, would be a great benefit as well. And I think this test, getting to more remote areas or getting to areas where there are cases of HIV that have not yet been found would be an important part. And I think that's everything, yeah. Thank you guys so much.